Hello, thank you for your invitation for me to discuss with you how to write a winning abstract and manuscript, what do editors and reviewers look for. Before we do that, I'd like to encourage you to submit to our journal. I'm the current editor-in-chief for Jack Case Reports, and please use the attached QR code here to look for instructions. We welcome all kinds of categories of submissions, and this is a journal especially for trainees and those of you who are in early career in cardiovascular medicine. Here are my disclosures. So the general principles of a winning publication is first, you need to have an article that engages the audience. But more importantly, you need to engage the reviewers because that's the first hurdle for them to accept your paper. Second is that you need to be succinct and on point. The manuscript or the abstract should be easy to understand and follow. Make sure you include informative figures and tables. And finally, make sure they don't contain any errors, including spelling or grammar. Tips on submitting an abstract. Don't wait till the last minute. These takes time for revisions and edits. So don't do it the night before or an hour before the deadline. You're not going to write an abstract that will get accepted. Know your reviewer and audience. Know what the topic's about. Who is going to reviewing your submission. Have a catchy but informative title so to get the reviewer's attention. And finally, always include a figure or table. The abstract submission portal, if you review the abstract and there's only text, chances are it's very unlikely to be accepted because it doesn't give the reviewer time to go through all the text. The figure or the table really tells the story. So the reality is that these conferences, the reviewers are very busy in their clinical practice, but they also have to review at least 20 to 60 abstracts per meeting. That's a lot of work. So with such a busy schedule, they only really have a few minutes to review each submission and make a grade to make or break your submission. So first impression is absolutely critical. You want to make sure the text and the data can be easily digestible. You don't want the reviewer to comb around and look for things. They should be obvious. And they also would naturally gravitate towards the figure. So you have a figure that tells a story and tells what you're trying to show, your study is going to be more likely to get accepted because it's going to tell the reviewer the gist of the study findings without going through all the text. So how do you prepare? So write it as if you're submitting to a journal, because you can use that same abstract essentially to write the manuscript. Have a template or writing style applied to all kinds of abstract of the same categories. Whether you're doing for clinical trial or observational study or basic science, have something in mind that you could just plug and play whatever study that you're going to be looking at and writing up about. That way you don't have to reinvent the wheel every time. Keep the wording succinct. Remember, this will take multiple iterations, not just to be first draft and you can submit it, especially you need to meet the character word limit. So for example, a lot of these meetings, if you include a figure or table, it deducts the character count or the word count. So you have to keep that in mind. So this is even more important to keep the text succinct and on point and make the figure impactful. My strategy now has always been now go for something more like a graphical abstract or central illustration. Don't just show a graph or table randomly. So the anatomy of the abstract includes a background. Usually it's one sentence, talk about what's not been studied before, and then one sentence for the objective to say, what you studied? What is the method and how was the study conducted? And then the results, the key findings, but be strategic of what you want to show. You don't want to show everything. Show what's necessary to get the reviewer to accept your abstract or grade it highly. Include a figure or table, as I mentioned before. And finally, one sentence on the study summary and why is it relevant. Now, in late-breaking trials, it's okay to say that the updated data analysis will be shown at the meeting because not all the analysis were being completed at that time. So here's a sample abstract. It's actually written by me and my co-authors and was accepted to an upcoming meeting in London. So you can see that the aims, so these are the categories on the left, aims, methods, results, and conclusions. So the aim, you can see in red what the problem is. This is particularly on redo TAVR. And so at the end of the paragraph, if people don't have enough time, they can say, what is the aim? What is the objective? And then in method, say, what are we studying? The patients with native aortic stenosis. What is the study period? It's highlighted clearly. What is being done? You see, we are doing a CT simulation study on 3 implant depths. And then what is our criteria? In the results section, you can now see what is the total sample size, what is the characteristic, very briefly included. And you can see that right away we say what is the feasibility, and it depends on the implant depth. And you can see that particularly commissural alignment would render the TAVR feasible in approximately 95% of patients. So we very clearly present your data. And in conclusion, you said redo TAVR feasibility is significantly impacted by depth and commissural alignment. So basically, you see that the title reflects that. Here's the figure that we included. You can see it's essentially by looking at the figure itself, you know what the study is about. 2,000 CTs, 3 implant depths. How do we simulate this? And then finally, the bottom part, what we found based on graphically, and you can see that statistically significant. So right away, the reviewer doesn't even have to read the text necessarily. Look at the figure and be able to understand and appreciate what the study is all about. Now, how about if you write a review article? You first have to research the topic in depth. PubMed obviously is a natural source, and you want to start with some recent review articles to be able to look at the entire literature, what people have written about already, so that you can offer something different from other reviews. Make it practical to the reader so they understand what you're trying to review and what the implications are, how it's going to change my practice. Break it down to sections and make sure they flow logically. And this is especially important if you have multiple authors writing different parts of review. You have to piece it together, but at the same time, they have to flow. It can't be choppy. And of course, the figures and tables have to be impactful and unique. So here's the nitty-gritty. So start with an outline with detailed bullet points on what content to cover. That way, when you assign a different author, they know what to put. You don't want to be free-flowing because then you go on tangent. You can have the content overlap each other. It's much harder to fix and trip. For each section, add the references immediately after. It makes it very easy to see what is duplicate and how to correlate at the very end. Now, if you have multiple authors write the review, you need to have one designated person to put it all together. And that person usually do the lion's share of the work. You need to harmonize the document so that it writes in kind of one voice. Finally, set a timeline and stick to it as much as possible. And you need a shepherd to herd the sheep. Make sure everyone is sticking to the timeline. So here is a JACC state-of-the-art review that we put together back in 2018. It was actually quite novel at the time. It was ahead of its time. But what really remarkable about this review is that we gave a lot of informative content. For example, this is a transcatheter valve. We showed the dimensions for the authors to be able to use it, print it out, and put it in their own cath lab or even use it in their own case discussion. More importantly, annotate the figures. Look at this figure here. You have to show what each structure means so people can understand what you're talking about. So that's an important aspect of putting together a figure. Look at the other figure is algorithm. You can see that here that we propose a treatment algorithm, so it makes it impactful when people say, okay, if I have this problem, I'm going to try to follow this logically to see what I need to do. And you can, in this particular case, use the specific catheter to engage the coronary. And then finally, a central figure, as I mentioned before, this is probably one of the most cited figures in this topic. Early on, people use it for slideshow presentations. And you want a figure, a summary figure for others to be able to use it in the slide presentations. And that's what we did. Now, tips on writing an original manuscript. This is probably one of the hardest things to do. So if you've already done the abstract, use that as a foundation. Make the figures and table first because that will guide you what data to present and how to write the methods. So you have to write all these sections, as I mentioned before, and you want to make a catchy central figure or graphical abstract. Here's a nitty-gritty. So the title page follows standard format. Don't reinvent the view. You need to have a title, a short title, authors and affiliations. I would recommend you early career people to keep it blank. You don't want to be political about it. You list without the order initially, and then what the senior author, the person mentoring you, will decide who goes where. If there's funding or conflict of interest disclosure, you need to include that. Corresponding author will be determined later on. If you have social media handles, put that in there, put a small tweet. A lot of journals look for that. And of course, you need an abstract, a mini abstract, and abbreviations. And usually, for example, in JACC journals, it's up to 10 maximum. The introduction, you want to keep it simple. Brief background why your study is done. The methods standardize your headings based on the type of study. So for example, it's a clinical study. There's patient methods, how do the studies conducted, statistical analysis. Those are pretty much standard headings that you need to include. Results, again, standardize the headings. Patient characteristics, procedural characteristics, imaging characteristics, study outcomes, whatever outcomes they are, clinical outcomes, imaging outcomes. So you need to standardize the headings to make it easier to fill in the blanks. And you anticipate the reviewers' comments and critiques, address them in the discussion sections. And again, I want to encourage you to put them into headings to make it organize your thought process of what you're trying to tell the readers and reviewers in terms of how you discuss the paper. Always include study limitations. Not studies are never perfect, but be honest about it, but also defend your study. If you have strengths in your limitations, mention that. The conclusion should be fair, not embellished, okay? The tables, you want to include the key data, depending on study type. Usually a standard set of things to include. You can put the rest in the supplement if they are not as relevant. The figure should be strategic. You want to put the key findings and the rest in the supplement. The references, they sometimes have a limit, but don't cite everything, especially if they count towards your word count. You want to trim as needed, just to include certain key studies so that you can mention a priori. So here's a multi-center registry study that we published in JACC Intervention. And you can see that here, there's always a subheading. And you can see there's a list of abbreviation, and you can see the abstract here, which is standard background objectives methods. But you can see how we structured it in the method session study period, how many patients, break it down quickly, look at the outcomes, and you can see what we're trying to show. Very, very simple. 2 groups, look at p-value, and in the conclusions, you mention about what the study shows and what the implications are. So figures. You can see a flow chart is always good for such a study because you do show the reader and the reviewer how the studies get broken down, what patients are excluded, what is the final analysis. So this is a very easy to follow figure. You can see the left side, we talk about patient characteristics. Again, a very standardized table to report. The figure, the trends of the study, you can see that particularly relevant in this particular observational study. Indications or intervention, you can see how it's broken down between the 2 study arms and what the mechanisms are. So again, very high yield. Outcomes of the interventions, very important to compare the 2 groups. You can see that here, pretty standardized reporting, clinical outcomes and echo outcomes. And of course, you have outcome survival curves. You can see this is very important to include in your graphs. If you do a multivariate or univariate analysis for statistical purposes, you need to include those. You can see the predictors and you can see how the forest plot graphs are included. So again, very useful. And finally, the central figure, you can see again, but just reading the figure itself, and you can promote it on social media because they just use that one slide, and you can use it also for your presentations, that you can see how the study is being conducted naturally and what the outcomes are. So again, I think it's very important to think about how you construct these figures strategically. Now, what about an editorial? It's an honor to write an editorial for an original paper because that means you're an expert. Congratulations. So read the paper, obviously, but also what the editors and reviewers' comments for that particular paper. Ask for those because clearly the reviewers and editors thought about the strengths and weaknesses of the papers and limitations. So you want to address potentially some of those issues at hand. Scan the recent literature on the topic. You want to be able to smart about what other studies have been done on a similar topic. You want an overview of the topic and how the paper fits in to set the context and the tone. And you want to organize the opinion into sections so the reader can easily follow. Don't just write in paragraphs because it's hard to follow. Just like it's almost like a mini paper. Be kind and constructive in your critique. Don't slam the author's review. This is a published work. So obviously they deserve to be published. So don't be critical about it, but be constructive and maybe fill in the gaps on what the reviewers or editors may miss that you can compliment. Look at the study limitations, a guide to what you might want to comment on. And again, just like any review paper, abstract, you want to include a figure, a table, because a lot of editorials being written, but a lot of people don't read them. If you have a figure that's impactful, that might end up actually in a slide presentation at conference, and we've seen that. And that is an opportunity to highlight your editorial. So here are two examples of two editorials that I've been offered with. And you can see that here, the left one, you have a title and you have a catchy phrase. That allows people to know what this is about. And you can see this is a table showing the two important topics and what the factors are relevant to that particular article. On the right side, you can see that I have a title, but again, I have a catchy phrase to catch the author's attention. You can see now this is a figure showing some of the issues at hand, and you can see how this is nicely shown as a summary of the field. So again, the editorial is not just about the paper, but it can be about the whole field in general. Now, what the editors and reviewers look for, they're looking for high impact novel study. It needs to be well written and easy to understand. Methodology has to be sound. Obviously, there are limitations, but clearly stated and being honest. The data need to be well presented, fair and impactful. And again, easy to read, understandable figures and clear tables. And you need to have a comprehensive and balanced discussion. It can't be saying, oh, my study is the best thing since sliced bread. It does not work that way. You need to be very much thoughtful on what your data means to the scientific community. Now, just a briefer on artificial intelligence use, because journals now have policies on AI usage in manuscript writing. I think, especially English is not your first language, it's reasonable to use that to spell check and make sure you correct your grammars, because nothing is more annoying than errors in the manuscript because of spelling errors or grammar errors. It may be helpful to make the writing more succinct and clearer to the reviewers, so you avoid run-on sentences, with both sentences. You can have AI to help you with that. But it's not okay for them to write the paper for you and to write the content. And often, in fact, it can be wrong. So we've seen sometimes AI using, if you plug in your data, that it generates wrong data and results. And worse yet, it makes the study invalid. Now, what really annoys editors and reviewers is that not following the instructions. The instructions are there. Follow them, read them. For example, the formatting or the word count, that's an easy way for them to reject the paper or ask you to do it again. You don't want to do that. Hard to read. Remember, reviewers don't have a lot of time to read these papers. They have very busy schedule. They review a lot of papers. You want them to be easy to read, to flow logically, so it reads like a story, so it creates a pleasant experience for the reviewer. Make sure there are no errors. Try to avoid missing data and errors found in data reporting and presentation. You don't want that to happen. You don't want to be too biased in discussion inclusion, because the reviewer said, well, that doesn't make sense. Your study findings are not reflected in what you're trying to say in your conclusion. So that's a way for the reviewer to reject it. Sloppy figures of table. You're missing labels. You're not having p-values. You're not showing the annotated arrows or findings that makes it easy for the reviewer to understand your figures. That's an easy deal breaker. And of course, never plagiarize. Even from your own papers, people can tell now. They can use AI to look at this. So you definitely don't want to be compromised that way. So the take-home message is that it does take time to hone the skills of writing a winning abstract and manuscript. Organization, meticulousness, and perseverance, I think, are key to success. You can attend webinars or sessions at conferences to learn about tips and tricks. They are out there. You can watch YouTube videos, I'm sure. Have a mentor who can guide you throughout the process. Not just say, hey, doctor or professor, this is the final draft. You take a look at it. Start early. Show them the outline. Show them the figures. Show them the data and tables. What I need to tweak. I've mentored one of my superstar, now interventional cardiologist, Syed Zaid, for 10 years. It's now really, really rewarding to see how far that process have come along of mentoring him, of writing abstracts, Now papers reviewer, now he's writing his own first offer and senior offer papers. Sign up to be a reviewer for journals. One of the best way to understand this process is to be a reviewer yourself. You can be an early career person, can still do this. And they're always looking for help. So by looking and reviewing other people's work actually helps you strengthen your writing as well, because you know what the pitfalls are. And if you have the opportunity to be on an editorial board, sign up for it. That means you earn your stripes and learn the process. It's very, very informative and educational for your own career development. So on that note, thank you very much for your attention again, and good luck.